Hi, I'm Meris, and in today's video we're going to be talking about cultural considerations along with complementary and alternative medicine. I'm going to be following along with our Fundamentals of Nursing flashcards. These are available on our website, leveluprn.com. If you have a set already and you're following along with me, we're going to be starting on card number 26, so let's get started. Okay, so first up in cultural considerations, let's start with what is a culture. So a culture is going to be shared beliefs, values, and or customs that are influenced by race, geographic location, ethnicity, language, those sorts of things. We strive to provide something called culturally competent care, meaning that we are meeting our patients' religious and cultural needs as well as their health and medical needs, because this improves patient care and improves their outcomes and their feelings on the care that they received. When it comes to culturally competent care, we need to start with a cultural assessment. Cultural assessment is going to be essentially just identifying what your patient's cultural, religious, spiritual needs are and the ways that we can cater to those, what our best practices may be. This may also influence things like the medication that a patient receives, the therapies they receive, and even things like post-mortem care. We also want to talk about something called ethnocentrism. Ethnocentrism is the belief that one's own culture is superior to somebody else's. This is not a belief that we should have as nurses. This is going to be a negative connotation for culturally competent care. We do have a key point icon here, which means pretty important. Cultural competency begins with identifying your own beliefs and values so that then you have an idea of where you're coming from. So the nurse should start by identifying his or her own beliefs and values. Next up, let's talk about language and interpreter use. So you will be caring for patients who speak many languages, and it is important to understand that patients have a legal right to have a medical interpreter available to interpret for them. Notice that I said a medical interpreter. We do not want to use a patient's friends or family members to interpret if at all possible. We want to be using an approved medical interpreter hired by the facility. It's also to understand that when we use a medical interpreter, we have some ways that we can communicate best with the patient when using an interpreter. For instance, we want to speak directly to the patient, not to the interpreter. We're having the conversation with the patient. The interpreter is just, assisting us. So we're not having the conversation with the interpreter, so talk to your patient. The other thing is when you are using an interpreter, try to ask one question at a time to allow the interpreter time to ask the patient and then give you the response. And also try to limit your use of additional hand gestures and things. So instead of saying, "Do you want to eat?" just say, "Do you want to eat?" That is going to be best practices for speaking with an interpreter. It's also important to understand that there are different cultural practices that may influence the care that you provide. This may be based on religion. So we have here some examples of religious considerations. Here on card number 28, we do have a nice chart here for you. But before I begin, I want to point out this key point at the bottom here, which is that regardless of what your patient's stated religious practice is, every person practices differently. So it is best not to assume based on these kinds of general religious preferences, but instead ask your patient directly about any religious practices that they may follow that would influence their care. For instance, Jehovah's Witnesses may refuse blood products. So if they were having surgery, they may say that they do not wish to have a blood transfusion. Patients who follow Islam, they may not want pork products, they may not drink alcohol, shellfish may be prohibited for their diet. There may be special fasting considerations during the month of Ramadan. You may need to make accommodations for your patient to be able to pray 5 times a day. And female patients may request female care providers. So those are some possible considerations for your Muslim patients. Now, when it comes to Judaism, some patients who are Jewish follow kosher diets, but not all patients do. So you need to ask and not assume. problem, but if your patient does follow a kosher diet, then this may mean that they have no pork products or shellfish, and that meat and dairy should not be combined. For instance, a hamburger would be okay, but a cheeseburger would not. Then we also have Mormonism. Patients who are Mormon may abstain from alcohol, tobacco, and caffeine products. And then patients who are Catholics, they may avoid meat on Fridays during the period of Lent. So again, if you were in that time period, you would just want to ask your patient about their dietary needs for their religious preferences. Lastly, we're going to talk about complementary and alternative medicine. This is sometimes called CAM, C-A-M. You can see here on card 29, we have a very nice list here in a table form of different types of therapies and possible contraindications. Now, why do we call it complementary and alternative? So complementary means that it is going along with more traditional forms of medicine, and then alternative may mean that is being used in the place of. So it's very important to assess for a patient's use of CAM during their initial intake assessment. Now, I'm not going to go into all of these. You can refer to the card for more detail, but here are some important contraindications to understand. A patient with acupuncture, like if that's the kind of practice that they're interested in, it may be contraindicated if they have a blood-borne pathogen, just because there is the potential with pricking the skin and getting blood out. That could be a possible contraindication. Massage is a great use of CAM for many patients. However, a patient with a deep vein thrombosis should not receive a massage, as this could dislodge the clot. And then also a patient with psychosis. This is something as well that we should be thinking of. Another one we have here is a hypnosis and meditation. These can be great tools for patient. However, again, psychosis, either current or previous, may be contraindications for a patient. Some other ones that we have are herbal supplements, hypnosis and meditation, chiropractic adjustments. We have a whole list here. It's really important to understand where your patient is coming from and what might be contraindicated for them. Herbal supplements, for instance, you really need to know exactly what they're taking and how much, because there are the potential for interactions. Definitely see our pharmacology flashcards and videos for more information on that. Okay, so that is it for cultural considerations and complementary and alternative medicine. I hope you liked that. If you did, please be sure to like the video. You can always leave me a comment down below. I would love to hear from you. And be sure that you subscribe to the channel, because you want to be the first to know when we post new videos. For instance, in my next video, I'm going to be talking about patient positions, which is one of the biggest things you need to know as a nursing fundamentals student. Thanks so much and happy studying.
I invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. If you found value in this video, be sure to hit the like button and leave us a comment and let us know what you found particularly helpful.